It's most likely the spleen, but it's a little hard to say because here comes her stomach, and this is much more enlarged than it should be. And I have some changes to her liver area, so when I enlarge on that, now is it mammary, is it another kind of cancer? You know, we know that she's got that, and this is where she's getting changes of her process. See how that's changing? That's pretty abnormal, and I gotta tell you, most dogs are not walking. Her back is essentially ankylosed. It's fused together, and then she's got arthritis right here, so she's got fusing of the top of her back and ongoing arthritis. Now sometimes cancer can sit in their spine and seat there, so it could be a potential that's going on with her. But when I get down here, she's got some stool to pass, but right there, there's no question that's a mass. And again, I don't see her spleen. We could take the second view, but I said, let's just stop till you and I get a chance to review. Also, she's not particularly comfortable, so to try to get that, you know, where we can talk about what we need to do next. So again, I tend to think it's her spleen. Now, when we see the stomach, we don't generally see something like this. Usually it comes down very narrow, so that makes me wonder whether she has a mass on her stomach, in her pancreas area, or even coming off of her liver, because it's fairly aggressive in that area. That's probably just a little nipple there, but again, we've got pretty dramatic changes, and whatever is going on, I tend to think it's fairly aggressive at this point in time.
Wow.
Your second film that looks at the chest, which makes me, and again, typically if we're looking for cancer, we do 3 chest x-rays. And with her, we are considered with the heart murmur, are we also maybe dealing with heart disease? And when I look at that, there's no question her heart is large, and her lungs look a little bit questionable, but when we go in, when we look at cancer, we look at what they call almost like a snow shower effect. When we get in there, we can see all these little end-on vessels. That could be the start of cancer. That's not an atypical way for cancer to start. You just start getting all these little seeds, more or less, and then it changes very abruptly. The other thing is when we look at her heart, again, it's much larger than it should be. I don't see a mass per se. Again, I didn't do all the views that we would typically do on her, but I definitely see changes that are quite abnormal, and this does not go with congestive heart failure. This goes with maybe we have asthma, more likely it's cancer along those areas. So now the question is, you know, where do we go with things? And on her, we have that mammary area. The question is that cancer? What kind of cancer is it? In the abdomen, what is that? Is it cancer? Is it, when we look at a dog that's more than 10 years of age, if they have a mass on their spleen, it tends to be more likely cancer than not. Animals don't need their spleen. So it means you can do surgery and you can remove a spleen. So we certainly have the option to say, well, let's just go do surgery, do an exploratory, take this mass out. The only thing is when I see that area around the stomach, it makes me wonder, like, you may be euthanizing her on the table, because if we open her up and we say, okay, we can take the spleen out, but look, it's everywhere. It's inhumane to say, let's wake her up when we already know that it's seated. So the best recommendation would be doing, you know, either 2 things, which is say as quality of life. You know that she has a mass in her abdomen. You know that she has a heart murmur, and you just continue doing what you're doing, and just know. I'd still say the blood work would be beneficial, because maybe there's some things we can tweak.
Laterals for chest 2, or just the 2 laterals?
If she is comfortable enough for the 2, that'd be great. So we can just say quality of life, let's do the blood work, let's see what comes in, and just keep her comfortable with whatever happens. The second option is to say, let's pursue this further, and to pursue it further says, let's get an abdominal ultrasound and to start with, and then let's get the fine needle aspirin on that to see if we can say what kind of cancer is this, or is it even cancer, and go into that
spot, right?
Yeah. But again, that could have been the seat. Like I said, I can feel a cord going down. I don't know if that could have been, you know, the source of everything. And depending on what that looks like, then it says, should we do a cardiac ultrasound? Because again, my cardiac ultrasound is sort of a little bit lower. And she's got a good sized heart murmur, no question. But if she's got cancer throughout, it really doesn't, you know. So Let me go see what our other dog has. You can think
Okay.
about if you want to do an abdominal ultrasound today.
Call my husband.
Yeah, call your husband.
He's in
and
Vermont.
See what he'd want to do. Again, I agree with you. I don't think she looks any worse for wear. Like you said, you wouldn't have known it. So we certainly have the option of let's just see what the blood work looks like. I would recommend sending it out versus doing it here because we're going to get a more comprehensive screen that way. And then we could always see her back on Monday for the abdominal ultrasound if we're doing an aspirate, or we could do the aspirate today. So talk to him, think about what you'd like to do, and I'll go see. I'm sorry.
Thank you.
Stinks.